So before we go into the details of treatments, how do we diagnose, if you have hormone sensitive prostate cancer or hormone resistant or castration sensitive or castration resistant, how do we diagnose this? So Dr. Tawagi, can you tell us, what is a PSMA PET scan and how has that changed the paradigm on how we look at these two varieties of prostate cancer?
Yes. So in general, when a male patient has an elevated prostate level in the blood or PSA, and they have a biopsy, perhaps that confirms prostate cancer, either from the prostate or from a site where the cancer might have spread to, then we want to know where is the cancer in the entire body. So we used to do imaging with CT scans and bone scans, but now we have this new imaging, which is not approved for all patients, but we try to obtain it in some clinical circumstances, called a PSMA PET scan. And PSMA stands for prostate-specific membrane antigen. And essentially, the way that I describe it to patients is think of prostate cancer cells as having this little flag, and this scan will light up exactly on that flag everywhere in the body. It does show some activity in some normal tissues. However, it's a way more accurate way to identify where the prostate cancer cells are. And so this has been a new form of imaging that we've had in the last few years, and it's increasingly becoming more available. Again, it's not available for all patients. Sometimes we still have to do the regular CT scans and bone scans, but we are seeing more and more of this type of imaging. So basically a full body scan that will light up anywhere where you have that little flag, that PSMA, on the prostate cancer cells. And as you can see on this picture on the right, as I mentioned, it does light up in some normal tissues. So the salivary glands, the kidneys, you can see that there might be some activity there, but in general, it's a very accurate test for that little flag on the prostate cancer cells called PSMA.
And definitely, one thing I wanted to ask you guys, I guess, when we have patients that come in the clinic, they have a diagnosis of stage 4 prostate cancer, are you trying to get PET PSMA scans on all your stage 4 prostate cancer patients, or are you pursuing, CAT scan and bone scan exactly? Because I have some conversations where patients have heard about the scan and they think, just based on, it being a PET scan and PET scans being associated with cancer a lot of the times, should they get a PSMA PET scan up front in that setting, actually? So how do you guys approach that conversation?
So I think the way I think about it is, as we discussed initially, that the progression can be from a localized prostate cancer setting to a castration resistant or a castration sensitive setting. I think in those cases, a PSMA PET scan can definitely be helpful to see if we have some localized disease that is coming up from where, let's say, a patient is having a rise in PSA, and you don't know where that PSA is coming from. And PSMA PET scan could give us a good idea if there is a spot, that is lighting up on a PSMA PET scan. Sometimes you can do some localized measures to delay the treatment. And, that is one place where I do find the utility of PSMA PET scan. The other places, obviously, I think, moving forward, and I won't go in too much details, but, especially for some adenocarcinomas, when they are transitioning to an aggressive kind, in those cases, PSMA PET scan could be helpful to understand initially if they had a PSMA avid disease and now they don't. So that is another place where we see a lot of use of PET scan. But I'm curious to hear what Dr. Tawagi has to say about her practice.
So definitely in the setting of prior localized prostate cancer just located to the prostate that was treated, and then you see a rising prostate level in the blood, and you're wondering, to your point, where are these prostate cancer cells? It's useful to do those PET scans. The other setting that we commonly get them are for the metastatic or stage 4 disease that no longer responds to hormone treatments, when we're thinking about some of the newer treatments that we're going to be covering in this episode. And so that's another setting that we get them. So I think the role is definitely increasing in terms of getting these scans, both in the localized setting where the level comes back, or at the initial staging, if you want to know for sure that the cancer hasn't spread to other places because you're considering surgery or radiation. And then in the stage 4 setting, when you're considering some of these newer radioligand treatments, which I know we'll be talking about.
Yeah.
Definitely, definitely.
Definitely. It has definitely given a new option to our patients.